Hello, I'm Dr. Herman, and I'm with a patient of mine. This is Mrs. Jividen, who comes to my clinic in South Florida from out of state. She had a horrible neuropathy, what they have called small fiber neuropathy, right? That was the diagnosis. Was that the diagnosis before that other test, by the way, that you just shared with me from December?
No.
So that test in December showed small fiber neuropathy.
Right.
Right, okay, and that was their confirmation from mid-December or so, they said that. Now, so she had small fiber neuropathy as it was diagnosed. Now, she also had extreme exhaustion.
Correct.
On 0 to, and let's go through, we're going to go through a few symptoms and then the changes that she had. But the extreme exhaustion on 0 to 10, if 10 is the worst kind of exhaustion fatigue that you could have, how would you rate your exhaustion before you met me?
It was a 9.
A 9. And there was a mental fogginess also?
Yes.
Yeah, and 0 to 10, if 10 is the worst?
About a 6.
About a 6. And you also had night sweats that were pretty much every night, night sweats?
Yes.
Yeah. And you also had constipation that was, and how bad did the constipation get for you? You were just sharing with us before this?
Yeah. I was feeling so awful. I actually had to go to the hospital. It was 4 or 5 days of not having a movement, and then even after that, when I thought I was back on track again, it still was off.
Mm.
There would be a few days I wasn't having bowel movement.
Not good at all back then. Sleep was difficult as well. You could not stay asleep before, right?
Right.
It was pretty hard to stay asleep throughout the night.
Right.
And you also, again, let's go with the neuropathy. You said that the neuropathy was in the feet. There was shock-like pain.
Yes.
There was burning pain.
Yes.
There was tingling in the feet. On 0 to 10, before we met, 0 to 10, if 10 is the worst kind of neuropathy in the feet, what were you rating it before?
A 9.
A 9. And was your walking, was it real simple to walk before? I mean, did you have short walking where you had the pain that was intense, or was it you could walk long distance before you met me? Were you walking long distances? What was it?
No, I felt I was very uncomfortable and nervous to walk. Even to pick up a few things in a grocery store. 10 minutes was maybe about my limit,
Mm-hmm.
and then I'd be in excruciating pain.
And did you have to stop walking and sit down and then recover, or was
Yes.
it just like the pain just lingered and?
Even if it was intolerable. Even if I would sit, it wasn't going away
Wasn't going away.
for a while.
The hand pain, 0 to 10, and the hand pain was burning and tingling.
Right.
And how intense, 0 to 10, was it before we met?
Okay. In the hands, it wasn't as bad, but it was still maybe about a 6.
Okay. So now let's go with where we are now. You're sleeping. You've improved with your ability to stay asleep now by how much percent? 0 to, if we can call it, I have not improved, and 100% improvement. Where would you rate it with your sleep now?
80%.
80% is humongous. Your energy now compared to what it was, 0 to 10 it was before the energy was, you said about a 9 or a 10. What is your energy now? What is the exhaustion level, I should say, 0?
Right. Exhaustion level, maybe a 3.
Maybe a 3. And that's
I
maybe because,
noticed drastic improvement in my
Dramatic.
energy.
awesome. So all the chronic fatiguers out there, here's proof that when we clean up the infections and toxins, which I'll talk about in another video, clean up the infections and toxins plaguing the tissues, and we can do it real quick and simple, and she's feeling this different already. The mental fog that you had before, what do you consider now? Is it 100% gone, 80% gone, 50% gone? How would you rate it now compared to what it was?
90%.
90% gone. That's a smile. She's laughing, happy. The night sweats that used to be, how much improvement now compared to what it was? 10%, 50, 80, 30?
That too is just about gone. I would say 95%.
Wow. The constipation?
That's doing very well. Drastically improved.
And how often?
80%.
Yeah, how often?
Because, I mean, for me, I know everyone is different, but
Yeah.
I have a daily bowel movement.
A daily, and one, and sometimes two, or
Sometimes
just
two.
one? Sometimes two, okay. But sometimes just one, but some days there are two, which
Correct.
is very good. And they're good bowel movements, not just like one little pebble.
Right,
Yeah, good bowel movement.
right.
Okay. You're able to walk less or walk more now since we've done the first protocol. Now this is today after her second exam, after she completed her first protocol from her first exam. So these are after she followed the first protocol at home. She didn't have to come in every week to the clinic. She did steps at home. Yeah, one trip here and you've been at home doing everything. Very simple too. No exercises, nothing like that. But are you able to walk longer distances now with less intensity? in the
Yes,
feet?
yes, definitely.
And the hands, the burning and the pain that was in the hands, is that still there?
No,
100% or 50% or 80%? How would you rate it? Improvement.
90%.
90% gone.
With the
90%
hands.
improvement because there's 90% relief of the burning and the pain in the hands.
Yes,
And you also had prior to coming to me, years ago, you had a neck trauma where they did surgery on your lower neck, your neck area.
right.
Which
Cervical.
Yeah, which we did. Some physicians will think, well, the cervical trauma with the surgery for discectomy in the neck, maybe that's causing the hand pain in both arms, right?
Mhm.
But that wasn't, obviously, because you still had the surgery that was done years ago, and now here we are with 90% hand relief, hand pain relief, humongous. And we didn't treat the neck. The foot pain, the shock-like pain that you had, is that still there at all, or is that some improvement or dramatic improvement gone?
The shock-like symptoms are gone.
Gone, 100% gone.
100% gone. I don't get
No,
shocked.
zilch. The burning pain that you have in your feet, 0%, 50%, 100%, where is it now with the burning in the feet?
Give me about. I still get the burning periodically, 30%.
30% improvement or 30%?
Oh, no.
It's only 30% remaining.
Right.
Okay. And the tingling with the feet. I think you said earlier that's more noticeable now.
Yeah.
And there may be more
Yeah.
noticeable now, not that we're causing something that made her tingle more, it's just that your brain was so masked by all these other, confused with all the other symptoms, that now it appears more noticeable about the tingling,
Mm-hmm.
right? Even though the tingling may not be worse than what it was, but the shock-like pain and the burning pain, reduction of dramatic, and the tingling is still, it's there. So now in this protocol, we're removing more infections and toxins that have caused damage to your stem cells, your nerve tissue, and you're going to improve even more. And that I'm certain. I know you're hoping, I know you're happy, I know you're hoping, but you can see the results that we've had in the first round, so it gives you
Yes,
definitely much more security that.
I definitely know something was going on with me that I wasn't dreaming this. That
Yeah, this is real.
I've been improving.
These are real results. So I'll just say that she has not been diagnosed with MS. That might have been a concern of hers. She was not diagnosed with chronic inflammatory demyelinating neuropathy. There are some conditions that might have a much more extensive complications that we have to deal with. But in her first round, these are dramatic results. She's got the sleep improvement is dramatic. The constipation seems to be gone. The hand pain is gone 100%. The burning in the hands. The mental fog is pretty much gone. Night sweats are almost completely gone. The burning pain in the feet is dramatic reduction. The shock-like pain in the feet reduction. Feeling stronger, more energy, longer walking. We're doing pretty good. Yeah. So I invite you. You will hear a video from me that I'll put out about the findings from her exam in another video. But we're happy to share this information. I really appreciate you for helping me help other people know that the results can happen.
Oh, certainly.
And you had the guts enough and trust enough to give it a shot to give me a shot to help you get well. Move along.
I
in the
had
right
to
direction.
do this
Yeah. It was bad.
because I was in such bad pain. People go to just extreme things to rid their pain, but I heard of you on a fluke, actually through my massage therapist, and she saw your videos, and one thing led to another, and I thought, I'm going to check this out.
Yeah. And we're happy so far. So I thank you.
Thank
For
you.
giving us a chance. You're welcome. And hopefully, when we get through the next round and we have more improvement, you'll help me help others, but we can maybe film another one where we're 100% better and we can show the world that really this can be done. The small fiber neuropathy, so-called, from a diagnosis from a skin biopsy, they can say what it is, but here we are with living proof that even with that kind of diagnosis, people can get well. So my name is Dr. Herman. I'll put up my contact info on the screen, and I look forward to helping you too. And thank you again for helping me share this.
You're welcome.
Okay.